source of support that I have found to be immensely helpful is other post-COVID survivors. This is huge. And, you know, your family, your friends, your therapist, your physician can witness and walk through this journey with you, but nobody else truly understands it unless they're going through it.
Welcome to the Long Haulers, the official podcast of the post-COVID support community, where members connect with experts and other long haulers to learn how to heal from the effects of post-COVID. Here's your host, Munish Joshi.
Hi, everybody. I'm Munish Joshi, and welcome to the Long Haulers podcast. Our guest today is actually Dr. Darou, and we've got our medical director here, Ashdab bin Mohammed, as well, to join us for this conversation. And a little bit about Dr. Darou is a naturopath. And what her specialty is, I shouldn't say her specialty necessarily, but one of the great things she's known for in her practice is about bringing balance back to people's life. She helps you understand and remove the obstacles, repair the systems in your body, and she specializes in a variety of areas, including women's health and promotion of health through all stages of a woman's life. And today we're going to talk about post-COVID and long COVID and how naturopath medicine and proper care can help you live life again. Welcome, Dr. Darou.
Thanks for having me. This is a great opportunity for me, and I hope I can share something useful to your audience too.
And I'm sure you will. Everybody loves to see different types of doctors and specialists, and that's what I'd consider you to be. And if you wouldn't mind just telling us a bit about yourself and how you help people with post-COVID.
Sure. So I'm a naturopathic doctor, and I also have training in functional medicine, and I've been in practice for almost 20 years. Big part of my practice has been women's health, but the longer you work in this field, the more complicated cases that seem to come your way. My background is I used to be an engineer, so I'm very good at asking the question why. So it makes me dig a lot deeper into cases than maybe some other practitioners might. As a naturopath and also in functional medicine, we look at how systems interconnect. So looking at how your gut interconnects with your hormonal system, your endocrine system, or how your mitochondria, like your energy centers, are affecting your brain health. So we're looking at how things link and also looking at underlying causes. And that's maybe how we're a little bit different than what a conventional medical doctor would be looking at, is that we might have a slightly different perspective of how are things communicating within the body. I guess the past year and a half, I have had quite a few referrals of, long COVID cases. Some of them were existing patients, and then some are definitely not. I guess word of mouth travels. I can't say that I have an exact system for this because everybody presents quite differently, but I do find that in my practice that continuing to ask the question why, and why did a particular person get predisposed to having long COVID compared to somebody else, and what might have been underlying it with their health before they got sick has been very helpful in terms of getting people back to wellness again.
I think this is very fascinating. I think that you're going to be a very fascinating and beneficial guest to those people who suffer from long COVID or post-COVID, however they refer to it as, because it's multi-systematic and there's multiple symptoms that affect various parts of the body. And just out of curiosity, what are the most common symptoms you would see? I know there's over 200 symptoms associated with post-COVID or long COVID, but if you can just start with the top 5 that people present with in your clinic, that'd be very helpful.
So number 1 would be fatigue, especially exertional fatigue, so just inability to exercise or exert the body for prolonged periods of time. Next, I would say would be brain fog. Then I would probably put dizziness up there, dizziness or vertigo depending on the person. I see a lot of shortness of breath, and maybe hives. Hives or nausea, I would tie at number 5. Yeah, I see a lot of hives.
Interesting. We do come across a lot of people talking about their gut health. And Ash, I know from the work that you've done and from the conversations that we've had, we've heard some interesting stuff. But do you recall any of the symptoms that people have said? And maybe we can talk to Dr. Darou just a bit about that, because I think in the short run, these are some of the things that this conversation might give some immediate relief to people.
Yeah, I find, especially less so in clinic and more so in our support circle, people are really experiencing and expressing a lot of GI issues. I think nausea and a lack of appetite would be probably the top. Are you able to say, Dr. Darou, or is it kind of challenging in a very kind of varied environment? What do you typically see with nausea and loss of appetite with long COVID?
Some of it depends if there were GI issues before getting COVID, and some of it is just all created by the whole syndrome of everything else. So if there were GI issues before, then, there's likely to be, either some food sensitivities or microbiome issues or something like that going on. If it's all related to long COVID, there are a few things that I would be thinking about. One, is it related to the fatigue pattern, and is it a motility problem? That just the motility in the gut's not working, things aren't going down, they're going up instead. Which can then create issues with like small intestine bacteria overgrowth and that type of thing. And then the second would be something we'll probably talk about more. Is it a histamine issue creating nausea? Often when people have histamine intolerance, which again I'm finding is huge with a lot of people with long COVID, one of the symptoms along with dizziness and fatigue and brain fog can be nausea as well. And that's a more immediate reaction to what they've eaten. So a couple of ways that can show up for me.
Yeah, that's really interesting. And maybe we can go into the histamine right now. Tell us a little bit about the histamine intolerance and, what your theory is behind why that occurs post-COVID.
I actually have no idea about the why part.
It's a common theme with long COVID.
The why, I don't know. I see it after some of the vaccines as well. I've never said the word histamine so much in my entire practice as I have in the past year. And because I used to be an engineer, I do like a lot of pattern recognition in my work, where I'm listening to somebody talk and I'm like, oh, that looks like this pattern. And the pattern of histamine intolerance comes up over and over again. It presents a little bit different in long COVID to what I would expect in the rest of my practice. In the rest of my practice, I see more flushing and migraines and like redness, like rosacea kind of reactions, and sort of heartburn with histamine intolerance. With long COVID, I'm seeing more of the brain fog, the dizziness, sometimes hives, nausea. But the brain fog, I would say, is often something that improves with a low histamine diet and addressing histamines with either medications or supplements. So presentation is a little bit different, but the relief of symptoms is sometimes fairly big.
Yeah, that's interesting. And as you know, I do have a histamine intolerance, and I did notice quite a dramatic effect realizing that. So, and I do see it in clinic also as well. But yeah, quite interesting. Go ahead, Munish, sorry.
So I was going to ask, if I was to self-diagnose myself, what would I be looking for to see if I'm sensitive to histamine? Or have a histamine intolerance, I should say.
So the first thing that I do, because there isn't really a good test for this, is that I put people on a low histamine diet as a trial. And I make it pretty strict for about 10 days just to see, is there any difference? I would also add either like an over-the-counter antihistamine or a natural antihistamine like quercetin during that time. Because if there is a histamine intolerance, that's a pretty quick reaction in the body. It's not something that we have to wait for weeks to see if there's going to be an improvement. So I find 10 days is a long enough time to see, does it make a difference? And I can tell you what a low histamine diet would look like. Foods that are highest in histamine are anything fermented. So, vinegars, kombucha, miso, soy sauce, alcohol is a huge histamine food. And then there's, the leftovers. So leftover meats, things in the fridge for a period of time will start producing histamines. Yep. And then there's the healthy foods on the histamine list, which are spinach, tomatoes, avocados, eggplants, strawberries, and citrus fruits. And you can just imagine the perfect salad is a high histamine meal. So sometimes people are eating extremely well, but they've got their balsamic vinegar with their feta cheese on a spinach salad with some tomatoes and it's an avocado on top. And it's an extremely high histamine load in the body and can create some symptoms. So the trial run is a low histamine diet for like 10 days or so. If nothing changes, I don't really believe in food restriction for no reason, but it is something that I found to be quite useful.
And just out of curiosity, I'm not the smartest guy out there, but if you were having some sort of reaction, and is there some sort of fruit or food or something I could take that would give me some immediate relief that's low histamine?
A low histamine food isn't going to relieve it. An antihistamine medication or supplement might.
And is there something that's more faster acting than others? Because one of the things that people have explained to us is that they'll have a certain type of food and they don't know why. They suddenly get these sharp pains or they get the sort of reaction that they actually has been described as almost anaphylactic. It's not that they're choking up, but they're feeling this sort of sharpness and pressure in various parts of their body. So they seek relief. And some people have explained some of the stuff that they've used, and I don't want to name some of those things because it's not really vetted by somebody like yourself. So is there something there that's more soluble that's going to give them immediate relief?
I don't really consider those type of reactions to be histamine reactions. So I think it's a bit of a different type of thing going on. So I'm not sure what type of reactions those are, and what would give immediate relief. So I don't know exactly for that situation. Yeah.
That's fair, and that's good to know, because one of the things that's coming out of this conversation, which a lot of people are like, why can't I get immediate relief? It's still a new virus. There's still a lot of learning here. And you said something interesting too, that there's no test you can give somebody, but there's a plan you can put somebody on and see if you improve from this, then it's a pretty strong indication that you've got a histamine intolerance there.
Yeah.
And sorry, Ash, did you want to ask any other questions about the histamine? Because curious about a couple of other things.
Yeah, no, I was actually going to ask, is there anything, Dr. Darou, if somebody comes to you in your practice and, you have a discussion about their foods and supplements where you would say, you know what, look, like, I'm going to stop this right away. Is there anything that's kind of across the board when it comes to long COVID patients, or is it, very individualized?
That's a really good question. So even when somebody comes in and I'm pretty sure that their health issue right now is from long COVID, I try not to have any preconceived ideas of what's going on with them. Again, I'm looking for some of the similar patterns that I see commonly, like mitochondria issues and histamine issues and inflammation. But I'm trying to just meet the person where they're at, because whatever's underlying it, I need to do some pretty big detective work to figure out what else is going on in the body that I might miss if I just start jumping in on things. So I might take away supplements if it looks like they're taking too many things that are causing their liver and kidneys too much stress and not really getting to the bottom of it. I often find that people with health issues like long COVID are taking a long list of things, and there's a certain tipping point where that becomes, harmful instead of helpful anymore, even if there was good reason for all of them. So I often, cut people's lists down by half and try to prioritize. Wow, but I'll ask them, I'll say, what supplements do you think are actually making a difference here? Because otherwise I'm somewhat guessing as well. And then I'm also quite picky with brands of supplements in terms of like purity, quality, and effectiveness. So often people read on the internet that, like coenzyme Q10 is good for long COVID, but they'll pick up a brand that I don't know at all, and I look it up and it's sold on Amazon, nowhere else. And I'm a little suspicious as to whether this
Some
is
red
actually
flags there.
Useful. Yeah.
Yes.
Supplements are very poorly regulated, so you do want to talk to somebody who has some knowledge about, the company's quality assurance program and how, who's testing for the actual ingredients in the product itself. And food-wise, nothing across the board.
If you need a low histamine type diet, and we just have to live life and people are out and about, is there any type of fast food item that somebody can get, or are there any snacks on the go that you could recommend for somebody? These are the things that's a big challenge for people, because I don't think we're as well informed or understanding what is part of the histamine diet. And I know everyone uses the internet and just Google something and then gets a list and looks at pictures, but it's not necessarily a vetted source.
Yeah, eating out with low histamine is really tricky because the sauces are a problem with almost everything. So salad dressings are an issue, and sauces and Asian foods are issues, and also the freshness of the food is an issue. So eating out is actually really tricky, especially in the beginning when we're testing out how sensitive somebody is. So in the beginning, I usually recommend doing as much of home cooking and eating in as possible for that 10-day trial. And then I would say the most important factor of eating out is someplace that cooks the food extremely fresh, so that you're not getting those leftover histamines, because that's often where I see people getting reactions, is that a lot of restaurants reheat things and reuse things, and that's often where the ingredient list looks fine, but the reaction's out of proportion. So freshness is more important, minimal sauces, mostly things like, rice and veggies or potatoes and meats, and cooked fresh should be okay. Otherwise, in terms of snacks, probably best to pack your own. There's a lot of nut restrictions and there's a lot of dairy restrictions and things like that on low histamine, so it does get a little bit complicated, in terms of what to snack on. So best again to focus on, balanced, full meals in the day and not relying on snacking to fill in the gaps so much. Again, any restrictive diet is meant to be a trial in the beginning to see if we can get a change in your physiological response. And then from there, we do play around with it a little bit to see where your sensitivity lies, because some people are only sensitive to, the big histamine foods, but a little bit here and there doesn't really bother them.
Is there a fun snack that somebody could have who's suffering from, who needs a low histamine diet? Don't say raisins.
Oh God, well actually that's bad because dried fruits are not on the list.
It's a test.
Oh,
my favorite snack is pumpkin seeds. I don't know if they're very fun, but my favorite is especially the roasted salted ones, because I have to have a high salt intake with my pots.
Right.
So it's a win-win. They're tasty and they have a higher healthy fat content and they're low histamine, or it doesn't seem to bother me at least.
Good.
Those are my favorite. Yeah.
You bring up something interesting, because for the layperson, and I'm the layperson, I would sit there and say, you think the more of something that's good, like pumpkin seed is the recommendation, but I might go out and say, I'm bored with pumpkin seed. Let me get pumpkin seed with sriracha sauce on it, or the sort of powder in that. But that may be counteractive to everything. Yeah. Is there some things there that, if you were to do it, I think you said it the best there, Ash, that, the salt is there for flavor and it helps with another issue. If there is something, is there something that is more complementary, something they should avoid, like spice, for example?
Yeah, sauces and spices are often an issue, especially sauces with histamine. So again, because that's where we get the added things like vinegars and, or citrus or things like that. Salt is usually safe and a good idea. Again, the POTS symptom of the dizziness and the postural blood pressure issue require extra salt. So yes, salted pumpkin seeds, but a lot of nuts are high histamine, so we can't include all of them. Being careful with, the extra additives on the ingredient list is often a really important thing as well.
It's interesting, because when Ash and I have spoken to people, you really see that the treatment plan is hyper personalized for the individual.
Yes.
Because there are so many nuances there, and it's just great to hear that here, because the people who benefit the most are the ones who see the professionals and not just read an article and then try it and then wonder why it doesn't work and then try something else, but they're seeing a proper specialist, and that makes a huge difference. It's fascinating to me.
And it's a lot too, right? I mean, even myself, I'm, a healthcare professional and I'm, fairly knowledgeable, but for me to take care of my own health and to be in charge of my own health is a lot. And so I can imagine people who don't have that healthcare background trying to navigate the healthcare system and trying to navigate all of this online content. It's overwhelming, especially, considering the symptoms. And like we were saying, long COVID is so complex and multi-system. Yeah, so it is, Munish, to your point, it is a lot. Dr. Darou, what about inflammation? So we hear a lot about inflammation with long COVID. Do you have any recommendations for inflammation? How do you approach inflammation in a patient with long COVID?
Yeah, so it's often a big issue. The inflammation that got turned on by the virus seems to continue and perpetuate. It can hit any system, so it depends on where the weakness was, and usually there was a pre-existing weakness in terms of, some people are hit with their joints. It can hit the heart, the brain, the lungs, the gut, the hormonal system. It really depends, again, I think, where the weak spots were. And in some cases, that inflammation turns off in a week or two, and in other cases, it just keeps spiraling. So there are a bunch of things that I recommend for inflammation. Again, would vary somewhat in terms of what systems are being affected, but there are some sort of general rules of an anti-inflammatory diet that I really believe food is medicine, and there's a lot of ways we can turn on and off inflammation by what we eat. And then, yes, we complement that with supplements that can range, I guess some of the top ones would be, certain turmeric extracts and also certain fish oil extracts, but quite specific ones because we really want them to be active at the system level where they're affected. For example, for inflammation affecting the heart, I would use different nutrients than inflammation affecting the joints. An anti-inflammatory diet, there's some general rules of thumb in terms of, minimal fried foods, processed foods, saturated fats from animal meats, dairy and eggs, and minimal sugar. I often take it a step further because I find that when there's systemic inflammation, there's also gut issues. So I tend to put people on a hypoallergenic sort of elimination diet, again, as a trial to see can we get an effect. Some types of inflammation are easier to read that effect than others. Like pain is easy to read. You can see, is it working or is it not? Some other inflammation is harder to read, whether it's making a difference or not. And again, sometimes the benefit of a restrictive diet outweighs the struggle of it, and sometimes it doesn't. So often I find that gluten is a big lever in this equation, that going off of gluten can make a big difference with inflammation. Our bodies seem to be quite sensitive to North American wheat products, which I'm sure most of you know have been changed and modified from what they used to be. So, as trendy as that might sound, going gluten-free often can make a difference. And then the other parts of what's anti-inflammatory versus inflammatory can vary a little bit, whether, certain dairy products are an issue, or eggs or corn or soy. Sometimes we would do a food sensitivity test, or sometimes we would do an elimination diet as a trial to just see what's personalized for that person. But food can make a huge impact on turning on and off inflammation, but it does require some work and effort and some research in terms of figuring out what you need instead.
I'm curious, just one thing here. If I was to go gluten-free, or to go, and the word diet has been mentioned a few times, so it's almost like a lifestyle change. And I understand typically in this case it needs to be a lifestyle change, but at some point when you hit your goal with a diet, you're like, I'm done, or I can go back and have some sort of things here. And I'm just asking, if you do partake in this, is there a possibility of a cheat day where you could have a pizza, and would that have a detrimental effect on you? Because sometimes it can be a reward in itself to do things like that. Or would you say, you know what, not yet? For a COVID patient, that's something that's going to take time before we can get there.
Yeah, you just answered it. It's going to take some time in the beginning. Gluten especially, it has a really long half-life in the body, so it takes a long time before you get that inflammation turned off. So if you cheat with the one meal a week, that inflammation turns back on and then takes a long time to come out of the body. There are other foods that seem to have a shorter turnaround time, meaning if you ate a bunch of dairy or corn, the turnaround might be 24 to 48 hours as opposed to a week or two. So the goal is, again, long-term not being restrictive, and short-term meeting people where they're at in terms of what they can sustain without causing more stress. There are so many resources out there in terms of, good hypoallergenic or low inflammation products out there. Often we need some guidance in terms of finding brands that are, healthy ingredient lists versus junky ingredient lists. But cheat meals with gluten generally don't work. So usually what I'm sort of coaching people on is where can they find their gluten-free alternatives that are satisfying. So for example, I eat gluten-free for other inflammation issues, and I know where the best burger buns are. I know where the best pizza is. I have a place where I order bagels from. If I want a cake or a cupcake, I know where to get it. I don't eat these things every day, but I need to know where they are for occasional use so that I don't feel deprived.
And I think that's what it goes back to what we were saying earlier. It's all about balance. And finding that place that, where it nutritionally meets your needs, it meets your body where it's at, and mentally, it feels like more of a help than a stressor. Yeah.
We need to get our hands on that list, and maybe there should be a black market out there for this sort of stuff. Where's the best gluten-free bagel? I'm a little curious. One of the things that we focus on in what we talk to patients about is how to plan their recovery. And one of the things that, like, if you have a broken arm or a broken leg is the best example, there's a planned recovery where let's examine the bone structure, let's make sure that it's healed, that we don't see the crack, then we apply weight, and then eventually we rebuild the muscle, and we have a plan back to normality. In this case here, it's a little bit more complex. As we all know, for people who suffer post-COVID, we're talking a lot about gut health here, but the gut health leads to things that benefit, that can affect fatigue and inflammation, that we've talked about, two things here. What does that plan for recovery look like for a typical patient there with, say, fatigue and inflammation and that sort of gut health issue?
For me, it really depends what was underlying it in the first place.
Okay.
So what we find in our initial workup and assessment, I often recommend, depending on what people are coming in with, some extra lab testing to see if we can find those elusive underlying factors that may have predisposed them to getting long COVID in the first place.
Interesting.
And that, can be so many different things. Sometimes it's the scenario of they've been exposed to other, viruses that their immune system is still working on in the background, like Lyme or Epstein-Barr. I've had quite a few cases where there's been an underlying severe B12 or iron deficiency that I think is like the big tipping point. And, we don't think of that as being such a big deal because most women are walking around with that.
Yes.
But it can be a big one. Or was it an enormous level of stress? Or was there an exposure to a respiratory irritant already? So it sort of depends on what's going on at that level and whether it's something that was easy to fix, like an iron deficiency, or really difficult to correct, like a toxin exposure. And then the timeline, again, my goal working with anybody is to get some tangible results quite quickly, even if it's not the biggest issue we're tackling first. Partly that's for confidence in working with me, and partly it's just for anything we can do to improve quality of life is important. So it is more like peeling the layers of an onion than having an exact roadmap. Again, it often requires a bunch of healthcare practitioners with different angles and lenses to be getting there. I'm not saying my way is the only way. I'm really happy when people have a team of practitioners they're working with. What I hope is that I can offer a different perspective, or a way of integrating information from different practitioners who are specialists in one area, or a view of, what are the underlying issues that may be going on as well.
That's great. I mean, the holistic approach of naturopath is really helpful, I find. And I find in healthcare in general, we are getting specialized and subspecialized and subspecialized. And I find having at least one provider who's able to pull it all together and look at the body and the mind and the person as in a holistic way really truly does make a difference. And I have to say, I meant to mention this earlier, but Dr. Darou, I mean, this, Munish knows this, but for everyone else listening, Dr. Darou was the person who has helped me the most with my long COVID, and has really made a profound difference, which is, why I'm happy and excited to have you here today, and, hoping to share your wisdom with the rest of the world. So in saying that, I remember one of the first things you talked to me about was, regulating my nervous system and mindfulness in the healing process. So I was hoping that you could maybe speak to that a bit, and why is that so important, and what are some of your best approaches to that?
Yeah, that is a huge one. And I would say that this applies to any kind of chronic illness, but especially ones like this where the body and the immune system are trying to deal with an infection. So to really make it simple, one thing that I always say is that your body heals in a state of rest. So if you're never resting, nothing repairs. So if you get hit with something that is massively inflammatory and taxes the immune system in a big way, like the COVID virus for a lot of us, and your body is maxed out with stress, it doesn't know how to repair because you're not resting. And a lot of people with COVID itself get nervous system stress with it, meaning they get insomnia and racing heart. I had that myself. I got COVID when I was quite stressed out, and I was shocked by how dysregulated my nervous system was, how high my heart rate was, how much I couldn't sleep in the beginning as well. So my body sometimes teaches me with experience with this one. So getting into COVID in a state of your sympathetic nervous system constantly being turned on can really inhibit the ability to fully recover from it, and for even the viral load to go down. So often part of the recovery is relearning how to regulate the nervous system. It gets more complicated because any kind of chronic illness upregulates the nervous system again, because you're constantly stressed out by fighting something. Yep. So, we need to look at, again, I don't have any single approaches here. We need to look at how can we get the body to relax, and what tools can be done with this. People often find that body work is really helpful here, like an osteopath or craniosacral therapist, somebody who actually can put you into a rest state initially because you're not able to do it yourself. And then from there, relearning how to, either have a mindfulness practice or a meditation practice, or a slow restorative yoga practice, or spending time in nature. It's relearning how to regulate the nervous system, because it does get very dysregulated by this virus for a lot of people. And it has a huge impact on their body's ability to recover and heal.
Yeah. And I think a lot of us are not great at regulating our nervous system at baseline. Stress and the way our culture is right now is very much that go, go, go. You kind of turn off your mind and your body to all of the, the signals that you're being sent. I know that was my experience, at least. I was very, very, high functioning, but very, essentially just living in a stress state, not understanding that, the importance of really downshifting and regulating my nervous system multiple times a day or at least, every day. So, how is your, I guess, the best approach to kind of explaining that to someone? Is it naturopath, or is it osteopath, or is it resting throughout the day?
So it depends on the person. Some people are so anxious they can't rest.
Yes,
and that's a problem too, right? Is that, trying to be quiet creates anxiety because the body's not used to doing it, or it feels uncomfortable, or you're in touch with anxiety symptoms like a racing heart or dizziness or something like that. So sometimes we do need somebody else to help us to get to that state safely. Really, like, your nervous system is meant to have a rhythm in it, where your sympathetic nervous system, which is your going and doing and being on, is meant to run for 2 to 3 hours. And then the parasympathetic nervous system, which is relaxing and digesting, is meant to run for 20 to 30 minutes. So we're supposed to have this rhythm through the day of like go, 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 rest and digest. Go, 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 rest and digest. So one way of helping the nervous system to re-regulate is to actually build in breaks every few hours. And, giving yourself some like unstructured downtime of not thinking, doing, and, and running around. I always like to give people a practice of lying down for 15 minutes for one of those breaks. Like, getting your body horizontal can be very restorative. I'm sure that's not a big deal for most people with long COVID. They need to be horizontal a lot of the day, so probably not the best thing, but maybe that's why the body's needing and requiring that as part of the nervous system.
Yes.
I don't know, but it just makes me wonder, why is everybody needing to be so horizontal?
Yeah, I've wondered that myself. It's so common. Yeah. Yes.
It's really common. Yeah.
Yeah, it is.
So practicing that and like learning to regulate the nervous system, turn it on, turn it off. There are also some like really interesting programs out there for when the brain, the amygdala especially, gets hijacked by an illness. There are some programs for nervous system regulation. One of them is called DNRS, and the other is the Gupta method. You can look those up. I often refer people to those online. They're super helpful for any kind of a long chronic illness. Long COVID fits in there, as well as like Lyme disease and multiple chemical sensitivity or some of the others that respond really well. They are a lot of work though, so sometimes people don't have enough energy yet to tackle one of those programs, but they are extremely effective as well for the nervous system piece of it all.
That's great. Thanks for sharing that. I think that's helpful for our listeners to be able to take something and move forward today with it.
Yeah.
This is all very fascinating to me because, when you talk to people with chronic illnesses, I have family members with some chronic illnesses as well, and they have brain injury. And with the brain injury, it's the same thing. The flight system is hyperactive, and the vestibular system isn't able to communicate and close off these circuits, so it causes these sorts of bizarre effects in the brain that leads to this sort of anxiety and this sort of tension. But as soon as they learn to relax the system, they can start to heal. And when people sleep, that's recovery mode, as you said. It's interesting. I mentioned before that what's the plan to recovery? You kind of have one. It's go get a proper assessment. This is really a case, and I've heard Ash say it before, to diagnose COVID, it's about exclusion. Let's take these things off and see what it is. And once we're confident in what we understand it is, then there is a treatment plan for that. Let's monitor and engage and tackle one thing at a time. And where there's some sort of interrelationship, i.e. if you get better sleep, will that help improve the fatigue? Let's focus and prioritize that. And then slowly build up to whatever your new normal is. Not sure if that's the right name for it, but people don't always like the new normal. Any other tips at all? I know we've talked about inflammation, but we haven't really talked about insomnia. I know that we've mentioned it here, but and is there a way? I know a lot of guys don't know how to meditate. If you ask me to clear my mind, it just goes to the last thing I saw on television. It doesn't clear very well. But are there any tips to learn how to meditate? Is there a shortcut to getting to that sort of state?
Usually if somebody can't get there by themselves or they're too anxious to relax, then I usually rely on, certain like apps and things like that to walk you through learning how to meditate or have a mindfulness practice. There's lots of good ones out there. I often refer to Calm or Headspace or Aura. There's another one called Stop, Breathe, Think for mindfulness. So I usually refer people to apps as a starting point if they're afraid of it or they don't know how to meditate or they don't have any guidance, because those programs are actually quite well put together in terms of starting with a couple of minutes and building from there. Otherwise in terms of sleep, it is a super common issue, and I don't know, a lot of what we do as naturopaths is work on the foundations, and some of it is common sense medicine. People need to be told to put their phone away before bed, to get off their screens an hour before sleep, to dim the lights, to make the room cool and quiet. So really just walking through some of the things that might be obvious to some but not to others around sleep hygiene, because we all have some bad habits around this stuff. What time is bedtime relative to your last meal time relative to bedtime. So just walking through the basics of sleep hygiene first, and then looking at what is it that relaxes you before sleep. And, it could be a meditation practice, but it also could just be reading a book in bed, or I really like audiobooks. I find they put me right to sleep. So somebody telling me a story, especially with a British accent.
I do the same thing.
That's right out.
I used to read textbooks to my kids, and they would always fall asleep with that. Yeah. And now I just talk to my wife, and she's out in minutes. It's easy. You did say...
For me, I need something that I look forward to, though. I have to want to do it. So for me, the audiobook was a better strategy than a meditation, because I looked forward to getting in bed and listening to the story. So sometimes you have to actually make it pleasurable. It's just because you're working so hard on your health right now, make the bedtime one fun.
I like that. Yeah.
So is a cool room better than a hot room to sleep in?
For most people. Unless they've got temperature dysregulation, which sometimes happens with the long COVID as well.
And how would you know if you have temperature dysregulation?
Meaning you're too hot, too cold, you're having a hard time feeling like you're comfortable in any temperature.
Okay.
Or you're sweating too much. Yeah, you would know.
Okay. It's not like your hands get hot or your feet get hot. Because I have that weird problem where my hands just kind of radiate. And tell you the truth, I have a tough time falling asleep. But I seem refreshed after 4 hours, which is kind of strange. But if I have 5 hours, I feel even better. But if I have 6 hours, I'm lethargic after that. It's a strange thing. But you've actually said the keys that have helped people. It's just, have consistency in the routine. Know when's your right bedtime. The electronics are huge. And make sure you don't watch the news, something that's negative to bring you into that before you go to bed. Do something positive. And for you, it's the audiobooks. For other people, it's reading. But any other tips? I've kind of jumped around here.
So general, again, I can't stress it enough, is to get a thorough assessment and figure out what's going on in your body. I find people come to me with blood work that's just only half done, meaning they haven't looked at something like their vitamin D level or their B12 level, that they don't know if they have insulin resistance. They don't know whether their cortisol is too high or too low. There's some things that we can really target that have a big impact on, either neurological symptoms like B12, or ongoing fatigue like an iron deficiency or a vitamin D deficiency, that are just so often missed in a workup. So I like to make sure that people are assessed properly first, and then also I find that people are often pushing themselves too hard. Immediately after COVID, that can obviously make it drag on, but even during the recovery, it's just the convalescence part is easier said than done. And giving yourself the downtime and the rest, and being honest with yourself what your capacity is at any given time, actually makes the recovery faster, not slower. And again, there's a lot more things coming up in a lot of cases, in terms of POTS and mast cell and that type of thing, that I'm seeing as sort of longer issues that are often part of people's assessment if they've been diagnosed with long COVID for a while. And if possible, finding a specialist who can help with some of those pieces as well. I find our healthcare system pretty hard to navigate that way, and getting sent to the right person. But at least making sure your blood work is thorough and you're correcting nutrient deficiencies, you're resting well, you're eating a nutritional anti-inflammatory diet, you've got somebody who's reviewing your supplements with you, so you're not just taking everything you read on the internet, that you've discussed with somebody about what good brands and doses and absorption would look like. And again, as a naturopath, we talk a lot about health foundations, about nutrition, sleep, movement, stress management, and just are there any gaps there that are really obvious that you aren't taking care of? And for so many of us during COVID, that was like community and connection as well. So looking at what else, that's actually an interesting one for nervous system regulation as well. So we need people in our lives to regulate.
Yeah. It's funny, if you're excited about going to have that lunch with a friend that you haven't seen for a long time, it just calms you in a different way. I think it's so important to have that connection. You see it, and athletes, they're so focused on getting better because they love the game so much, they tend to heal faster. It's that same sort of principle here. If you're excited about seeing somebody, you focus on your health a bit different. I had a question for you about these supplements. What's the most common supplement issue that you've seen? Is there something where people will take magnesium with something and they're counteractive? Is there anything like that you've seen typically with COVID patients?
It's too many supplements is the most common issue.
Too many? Okay.
Yeah, too many, and sometimes the doses are way too high. Like vitamin D you can overdose on, so you can't just take 50,000 a day and be okay. Vitamin D, if you take too much for too long, you get into an overdose state over time that's going to damage the kidneys.
Interesting.
So, you need to be monitoring these things, and more isn't always better. I'm really into targeted. And yes, with long COVID, there's going to be at least 5 or 6 things, but it shouldn't be 20 bottles of pills.
Okay. And Dr. Darou, I'm just being respectful of your time here. If somebody was to get a hold of you, what's the best way that you'd prefer somebody to get a hold of you?
The best way is through my clinic. I'm at the Inspired Wellness Clinic, or you can look me up online at drshawnadarou.com. That's the best way to reach me, is either online or through the clinic directly. Okay.
Thank you ever so much for your time. And again, I'm watching the time here and being respectful, but we'd love to have another conversation with you, because we can go on for weeks talking about this stuff here, and you definitely are a wealth of knowledge. And I'm learning a lot from this.
Dr. Darou, did you have any last thoughts that you would like to impart?
I guess the one thing I didn't talk too much about, which could probably be a whole conversation on its own, would be mitochondria functions, like those batteries in cells that get depleted. So that is something I think requires a longer conversation, but is an essential part of probably everybody's treatment protocol to sort of get through the long COVID piece.
Sounds like a part 2. Yeah. Our end game of conversations.
Yes.
Thank you once again. We'll share your details with our community and our group, and we hope to talk to you again real soon.
Thanks for joining us for this episode of The Long Haulers, the official podcast of the post-COVID support community. We hope you enjoyed this episode and that it'll help you take a step toward leading a healthier, happier, and more productive life. Take charge of your recovery at postcovidcommunity.com, where you can learn more about membership benefits and join our newsletter to get the latest information and tips from our network of specialized healthcare professionals. And don't forget to follow us on YouTube and your favorite social platforms at Long Hauler Life. Please share this episode with other long haulers in need of assistance. Take care.